Hi, this is Dr. Ramin Tayani from the Tayani Institute and Maria Richardson. We're here to talk about a couple of the cosmetic procedures. This one in particular is going to be about the radiofrequency technology called Accutite and Facetite, or collectively called the EmbraceRF. So we've had some pretty exciting stuff with that radiofrequency.
We have. Some really nice results.
Yeah, and we have three modalities, right? Accutite, Facetite, and Morpheus 8. We'll do a different video on Morpheus 8 because the pre- and post-op care is a little bit different and much milder in its treatment. However, the Accutite and Facetite are very similar. So you want to tell us a little bit about what you know about Accutite and Facetite, Maria?
Accutite and Facetite are kind of like a little mini facelift. So if you're not quite ready for the full-on facelift or don't need that, this is kind of the technology that will help take care of it. It's non-invasive. You don't need to go under anesthesia. It's more of a topical and an injected anesthesia. And it's just non-invasive. The recovery is very minimal. What I also like about it is that it's not an immediate change. I mean, you will notice some changes after the swelling has gone down, but it continues to get better over the course of 3-6 months. It helps to stimulate collagen production, which you will start to see that the changes that are caused by that over the 3 to 6 months. It's really an exciting technology, and like I said, there's very little downtime.
Right. In fact, the incisions are the size of a pen, the tip of the pen. For Facetite, we do one incision right under the chin, 2 in front of the ear, and if we're treating the nasolabial fold, maybe 1 up on the top of the nasolabial folds. And those incisions don't even need to be closed. They're penetrated with a small needle, and the probe goes underneath. Now, the difference between Accutite and Facetite, basically they're a probe. It's a double-pronged probe that has the negative and positive energies delivered. One is under the skin, one is over the skin to help prevent any burning. There's hardly any risk to the procedure. And the Accutite we use for smaller body areas or facial areas. So we can do brows, upper lid, lower lid with the Accutite. And the Facetite we would reserve more for the lower face, nasolabial, the jowl line, and the neck. And as Maria said, it is a great way to do something that if you're either not mentally ready or don't even need it, the facelift and or even eyelid work. Great results. The downtime is about 3 to 7 days. So depending on the person, you might have more or less swelling, but actually tell us about what the post-care is. Well, let's start with the pre-care. What do we do to prep for these?
Well, for Accutite and Facetite, there's really not any there's no medications to take prior to. You do just come to surgery with a clean face. After the surgery is done, the post-operative nurse does put on a compression garment that does wrap around your face this way and goes around your neck that you're going to wear for the next 4 days after the procedure, 24 hours a day. You're not going to take it off.
Well, you could take it off to eat or whatever and cleanse, but essentially you're wearing it the whole time.
Right. And then after that, for the next 3 days, you just wear it when you sleep at night. Now, if you're home and you don't mind wearing it, it feels good, you can put it on, but it's not necessary to wear it 24 hours a day from the 4th day through the 7th day.
Right.
I mean, sorry, the 5th day through the 7th day.
Right. Pain is pretty much not an issue. We've done many patients, I think over 100 now, and pain is not an issue.
Yeah, we've never had an issue with the pain. There is, some patients have the swelling, and anytime you have swelling, it's just maybe uncomfortable just because it's swollen, but there's not a pain issue at all. And then where the ports are that Dr. Tayani mentioned, we just have you put on an antibiotic ointment on those ports. Many of our patients have even said that the ports are hard to find after the 1st or 2nd day to put this antibiotic ointment on because they're so small and they heal very quickly. But that's the only post-care that's needed.
Exactly. I would make sure that we also mention that there is bruising potential. Some patients more than others. So and blood trickles down towards gravity downward. So if we do the eyes, you can get some swelling and bruising in the lower face or even in the neck. If we're doing the neck area, there is a potential for some bruising in the neck. So swelling, bruising, some discomfort is better than even pain.
Yeah.
And you will feel tightness. The tightness is very common. One of the negative effects of this procedure could be if we do traumatize one of the nerves in the facial area, you can have a droop of the lip or something like that, or what we call paresthesias, where it's a little bit of a numbness feeling. Typically that goes away within a few days. We've had only one patient where there was a little bit of a lopsided of the lip, but it went away within 48 hours. So typically, pretty minimal in terms of complications. I think that pretty much covers it, right?
It's a pretty simple procedure, yes.
We'll talk about Morpheus 8 in another video, and also Evolve. Those are other radiofrequency technologies that we have here at Tayani Institute and at DermaBear. So again, Ramin Tayani, thank you for watching, and Maria Richardson, have a great day.